Just talk about something not heart or echo related. Case 7 in my case series, a young patient who walked in after having fallen 3 days prior to that at home in the bathroom. On his right side of his chest, he had difficulty in breathing. He was tachycardia by 120, sinus tachycardia, and he was in obvious discomfort with SATs of 92% room air. So we did bedside ultrasound of his lung. You see this is on the left side. You see the pleura quite sliding nicely. You see A lines, and you can argue maybe one B line, which is of no clinical significance at all. And put the M mode on, and you see these kind of sand on the beach or the seashore sign. Again, you see sliding of the pleura, nicely A lines. When you go to the other side where the pain was, the pleura looks quite static. It's not moving, is it? A line's still there. And when you look at the M mode, it looks completely different to the other side. You can argue the A lines are more prominent, and you see what looks like a barcode, which is called actually a barcode sign. Pretty easy, isn't it? That's pneumothorax. So basically what you want to do is do your lung ultrasound, whatever protocol that you use. Lack of shivering, the marching of the ants, whatever you call it, sliding of the pleura, you don't see it. As you clearly could see there. When you put the M mode, the barcode sign appears compared to the seashore sign on the normal side. The A lines, for the more kind of expert ultrasounders out there, A lines get a bit more prominent, and you would not see the B lines whatsoever, because obviously you can see one or two B lines and you're not going to worry about them. Long point is another thing in literature that has been pointed out, where if you look at the pleura, or all alongside the whole of the pleura, what you see that there is a point that the pneumothorax joins the normal pleura. As in, like, one section of your image, you're going to see a static pleura. The other section, you're going to see the margin of the ants. That is the definition of long point, and that's where pneumothorax starts. Pretty easy. Always compare with the other side. Don't forget. And one thing to mention is there are many studies about this show that in the hands of an expert, lung ultrasound can be up to 90% sensitive, compared to 50% of your trauma patients who are lying supine in resus room that you do AP chest x-ray. Quite valuable. Thanks.